I could just have pressed admit all, but I didn't. Oh, well. Hi, everybody. Welcome. Welcome. Hi, everyone. Now, I'm going to get you all, if you can, to turn on your cameras. I can see Libby, Karen, Kathleen Menzies is there. So welcome, everyone. Hi, Libby. Thanks for coming.
There we go. Hello, hello.
Kylie. Hello, Rebecca. Oh, thank you. I can see you're in the car. You drive safely, Rebecca. Don't have a crash on our behalf. So while everyone is coming in, we're going to give everyone just a few minutes before we get going. There's Kylie. Welcome, Kylie. And Kathleen, Menzies and Karen. While we're waiting for everyone to join, we'll just give everyone a few minutes. If you can maybe introduce yourself in the chat and say what role you're doing and how long you've been in palliative care. Just while we're waiting, we'll give everyone maybe 2 or 3 more minutes. And can everyone hear us properly? Yep, good. We were saying that we think this one might be a Halloween special because the connection was a bit crazy and our voices went to like Darth Vader's. So if that happens, we apologize. Just a school pickup. Oh, yeah, cool. Well, you can get your kids to wave to us, Rebecca. All right. Maybe 1 more minute. So we've got Rebecca. Hi, Rebecca. And Kathleen. Hi, Kathleen. And she's a manager of the Northwest Metropolitan Palliative Care Consortium. Thanks for joining, Kathleen. And we've got Libby there. Just introduce yourself if you've just joined. Just waiting 1 or 2 more minutes. So maybe we get started. Sure. Okay. So there's Libby. Hi, Libby. Libby's a academic and researcher. And Karen's a project officer with the consortium as well. Thanks, guys, for coming. We're just going to keep adding people as we go. 1 more person. Hi, Gail. So welcome, everyone, to another PCNA webinar. And look, I'm so excited about this one. Probably don't tell the other people who attended the other webinars, but probably more than any of the others, because I think this is what this is about, connecting people who've just started in palliative care. And it's the type of thing that I wish existed when I started. So I'm just so pleased that you've all attended and that hopefully we can get something great out of it. So before we get into the webinar, I just want to do an acknowledgement of country. PCNA acknowledges the Aboriginal and Torres Strait Islander people as the traditional custodians of the lands and waters where we work. And we respect their historical and continuing spiritual connections to country and community and pay our respects to their elders, past and present. So there we go. So thank you, all of you, for joining us. So before I introduce our panel, who is Jessica Brown and Lisa Sunderland, I just like to do a little bit of housekeeping and admin before we get going. So the best way for us all to get something out of this webinar is for it to be interactive. So if you have questions or you think of things that you'd like to ask or add to what we're saying, add it in the chat and we will bring that into the conversation. And if we can, we'll have you on mute and you can actually just say it without being in the chat. Hi, Rebecca. Thank you, Rebecca, for adding that in the chat. And yeah, and if you can, and I understand that some people will be at work and won't be able to put their camera on, but if you can put your camera on, because it just makes us feel like we're all together rather than just names. So thank you for joining you. I think joining us, I think we probably have 2 groups of nurses in this, maybe 3 groups of nurses in this webinar. either nurses who are thinking about joining or becoming a palliative care nurse. I think we have nurses who are in palliative care now in their early career within palliative care. And then from the looks of it, we have nurses and experienced palliative care nurses who are here for support, which is awesome too. So welcome everybody. James, our admin guy, sent out some questions before we started about what you wanted to get from this webinar, and it was really great, very helpful. But there were so many expectations. Some people were thinking that this might be an introduction to palliative care, and unfortunately, it is not. So I just want to put that on the outset. But what we are going to do is talk about the challenges of starting in palliative care, maybe the benefits, and then we can show you where to get some resources to learn about palliative care as a specialty. So I'd like to introduce you both to our wonderful speakers. We've got Lisa Sunderland, she's a nurse who has started at Eastern Palliative Care about 1.5 years ago now.
Oh, almost.
Yeah, so about 1.5 years ago, and who came to EPC with a hugely kind of rich and diverse career in nursing, and she made the big switch to palliative care. So she's come today to share what that felt like for her, and maybe share what things that she wished she'd known at the start. And then we have Jessica Brown, and Jess is a nurse consultant at Monash Hospital, and she's been a community palliative care nurse for how long, Jess? 6 years?
6 years. I think before moving across. Yeah. Yep.
And she also had a really broad range of nursing roles in education, in research, in ED before she came to nursing, up to palliative care. So thank you all of you for attending. So I'm going to now, the way we're going to do this is I'm going to ask Jess and Lisa questions, and we're going to then start that hopefully will be a conversation starter. Oh, and someone said a question already. I want to post this question. Do PCN use nursing process, and if yes, do we use it in the nursing diagnosis? So, Shani, what we might do is park that question and come back to it, if that's okay. Where's Shani? I think I saw Shani. Is that okay? We'll come back to that question. Okay. So, actually, Jess, let's make ourselves bigger. Do you want to do that? Can you do that?
I think it's probably different on everyone's screen. Can
everyone see Jess and I feel like?
Yeah.
Pin you. I'm going to pin you. And I'm going to pin me. I don't know if is that helpful, or maybe we do it.
It won't show up on everybody else's screen because everyone's got their own setup the way they want it set up.
Sorry, you can tell I'm not a tech guru here. Remove pin. Okay, so my first question is, I'm going to get rid of that then. Okay, so my first question is to Lisa. So Lisa, as I said, you came to EPC with a really substantial career in nursing, but also management as well. And I just wanted you to share with the group, could you tell us how that transition felt? Mm-hmm. And what prompted, there's a few questions. Okay. What prompted you to take the leap? And 1.5 years on now, are you glad you made the switch?
Okay. All right. So I have been nursing for about 14 years now. I came into nursing later after I'd had my children. And I kind of followed where the opportunities went. I hadn't quite figured out what my passion was, I suppose, in nursing. And I've spent the last 8 years working as an ANUM on a mixed medical surgical ward. But we were starting to do a little bit more palliative care and starting to see some quite unwell oncology patients. And it got me looking for more education because I thought we could do it better. And I found EPC was doing a short introduction to palliative care for RN. So I came and did that course, which was amazing. And it sort of whet my appetite a bit more. And then a few months down the track, I saw that EPC were recruiting. And I thought, why not? Maybe this could be my thing. So I was probably like the first time I kind of followed my heart instead of my head about where I was going, and kind of just went with the process, applied and got a position, and then thought, oh my God, what have I done? Because I don't know anything. And and it was a bit terrifying for a bit. I'd never worked in community, which is what this is here. And I hadn't done palliative care as a specialty. I'd never even really had an office kind of based job. So it was all different. And luckily for me, when I started, my first 3 weeks were actually the foundations course that Sarah runs at EPC, which
And that wasn't an intentional plug there. That was unintentional. There's no, what's the word? There's no no bias. Anyway, go on.
just so happened
Yeah.
that that's how it worked. So that gave me a good opportunity to sort of, learn a few things before I kind of went out there. And I guess it was really scary because I just didn't really know what to expect, but I was really eased into it, and education helped. I had a really supportive team. They let me sort of grow into the role at the pace that was working for me. There was a lot of support, and I kind of learnt a lot about myself along the way. And when I walked in thinking, I don't know why I'm doing this, I've got nothing to offer, I started to realize that actually there was so much from my experience that I could translate into palliative care. So obviously in medical surgical nursing, it's all about patient assessment. And so palliative care is different. So they were skills that I had already. So that kind of helped realizing that, I did have some things, but
Yeah.
they just needed to be, honed.
That's right. And I
into
think that's
palliative.
huge, isn't it? That I think actually when you think, if you're a person in the webinar who's thinking about that making a leap into palliative care, and you think, oh, as you said, like, I'm not sure, maybe I can't do it because I don't know enough, but actually to remind yourself that you come with, even if it's not nursing experience, you come with a life of experience that will serve you in palliative care.
Absolutely. And I didn't think that the management experience that I'd had would actually factor into it in any way at all, but it really did. It has helped in other angles with managing workloads and managing people that you're sort of dealing with. But I just, the only regret I have is not doing it earlier. I've always enjoyed nursing and liked what I did, but it's actually the first time I can actually genuinely say I love what I do. And I do. I just had 6 weeks of annual leave and I felt a bit anxious coming back to work. And on the second day I was driving between clients and I'm like, oh my God, I really do love my job.
Oh, that's so good.
So yeah, I'm really happy I did it.
Right. And so, and it's so lovely. I know Lisa, right? And I've watched, it's you're a great example of to make that leap, right? And that actually it might be very hard and feel very overwhelming, but actually it's absolutely the challenge is worth the leap.
Yeah.
So then my question for you, Lisa, is if you had one tip for a person who is new to the specialty, say about where you are or just a bit earlier on, what would be your advice? What would be the thing that you'd wish you'd known before? Like not symptomy, like, like what advice?
I think one of the things that helped me was realizing that I didn't have to have all the answers. I didn't need to know all the answers. I just needed to know how to find them or how to look for them, what my resources were, and that it was okay to say to somebody, look, I don't actually know, but I'm going to find out for you, or we're going to work this out together, or And, you know, and that's what I do. If I'm in a visit and there's something going on and I'm not quite sure what the best action is going to be, if it's not urgent immediately, I'll say to them, look, I think I really want to go back and discuss this with the team, and I'm going to give you a phone call before I leave at the end of the day today and let you know what we think is best. So
that's great
and
advice.
it takes that little bit of pressure off and gives you time to figure it out.
Yeah, and I think that it's about saying that and to the client, giving yourself permission to say it to the clients, but also maybe even realizing that we all do that. I still do that, you know. It's no one, even though I think when you get in there, you think, oh, these people know it all, but actually everyone's still looking up their references and everyone's still calling in to check the medication dose, and that's okay. Yeah, that's a huge say. Thank you.
Yeah.
So what I'm going to ask some questions of Jess now, but I guess what I would love, if you are in the audience and you are someone who is thinking about, I would be interested to see who in the webinar is thinking about joining palliative care. Can you give us a thumbs up if you are someone who is here who hasn't made that leap, and that's where you are? Or and then we'll figure out whether the rest are. Yeah, okay. Thanks, Rebecca. Awesome. It's just interesting for us to know. Yeah, so thank you, Lisa, for giving us that insight. So now, Jess, I've got a question for you.
Okay.
So we both came to palliative care with really different kind of experience. I was newer, right? Like I was only 3 or 4 years out of my grad year, and you had done substantially more before that. And so I guess my question to you is it's same as Lisa. What's that one bit of advice that if you could go back in time, what would you tell new palliative care, Jess?
I didn't know I was going to be limited to one.
Oh no!
I wrote down.
No.
So I did. I came from. I'd done little bits of everything before coming to palliative care, and really I always enjoyed everything that I did. But I'd moved around a lot. So the fact that I've stayed in palliative care and have made it my specialty, and I don't plan to leave, is telling how much it's fitted with me. I think that. Again, because I'd moved around a lot, I wasn't particularly scared about starting. I was fresh to palliative care. I was fresh to community. So it was a little bit of a change system on just that workflow, how things happen. But I think what I found confronting was that it was such a different way of working, and the skill set is so different to that hospital-based nursing or providing education or anything else I'd done before, because a lot of the time in palliative care, you are sitting on your hands, and intentionally so. And I found that difficult. You are allowing things to unravel and then seeing what happens. And so you do need to slow down. And I think coming from hospital, even if you're working within a hospital, I can see Christine there, who I work with at Monash, is slowing the pace of things down. And that was not something, you're always rush in every job I've ever had. And even slowing the conversation down, sitting in silence is something that I really had to develop within myself. And that probably for me was a little bit more difficult than learning some of the other stuff that as nurses we're used to ongoing learning, and as Lisa said, all of your experience comes into your skill as a palliative nurse. So definitely slowing down the pace, being with family, and intentionally reducing the pressure by speaking slower, doing slower, allowing time, all of those things. And a lot of what Lisa said as well, that you will never know everything. So the pressure on, you've come from an area where you might feel like you know stuff, you know how the hospital system works, how this works. You're never going to know it all, because every situation is different. And because of the intensity of the human side of palliative care, you're working with humans, and it's going to be different all the time. I've recently gone from working in the community to working in the acute area. So that's been a massive change. And that looks very different. Very different patient cohort that you have in the acute system than you're having in the community. And that comes with its own challenges around the environment. So you were never going to know everything. Just don't ask, and
Love that,
learn
Jess.
to go easy on yourself.
Yeah, I really love that, because you're right. That's a real point of difference for palliative care, isn't it? That actually it's no longer about what needs to be done to the patient, right? It's about
Yeah.
what the patient wants, right? And that we don't have control over that, right? And actually being okay with that difference is a big thing to learn, isn't it?
And it's still that, as nurses, our job is to fix, to do, we try not to be task oriented, but that is a big part of our day. And that sometimes, you cannot fix things for the people that you're working with. They have symptoms that you can ameliorate most of the time. Sometimes you can't. And so we have to work with that as well. So being able to sort of sit with that is something that I had to learn, and that took a little bit.
And I like what you said too about going gently on yourself, because that's kind of
Yeah.
what Lisa was saying too, right? Is that you can't have all the answers, and it's okay not to have the answers. Yeah.
Yeah.
Thanks, Jess.
Exactly.
And
what about you, Sarah?
Well, no, and I was thinking about this question too, and I think if I could go back and tell new palliative care Sarah something, one would be to really understand your professional limits. And what I mean by that is, I think when I started, I was so enthusiastic, and I still am very enthusiastic, but so enthusiastic, and thought, no, it's okay to finish late, and it's, I can do a little bit of work at home and all these type of things. But actually, it doesn't. And I know this is a very weird thing to say, but we're very replaceable at work. And if work is having a cost, it shouldn't be at the cost of the home, Sarah, or home you, because home you is what's going to be there at the end of the day. And days off should be about building home you. I don't know how to describe that, but that's something that I've learned that I wish I had put into action earlier in my career. The other thing I think that has helped me that I wish I had found earlier on is to find your people, right? Find your person who you have to find a colleague that is at a similar stage to you that you can call to be like, this happened. Or just because you often find that your spouse can't do that for you, or they're not the right person to tell about the kid that died or the like the sad story. But Jess is my version of that, right? We call each other at the end of shift sometimes just to talk about sad stuff so we can separate. So yeah, that would be they're all very similar, aren't they?
And I did have that on my list as well, Sarah, because palliative, the palliative area is quite a little group, and everybody's really friendly. I think it's something about palliative care people. They're a friendly bunch. They're drawn to the people side of healthcare, and they are a friendly bunch. So get to know people, because even if they work at a different organisation to you, and you're just having to contact them about, they might be your consult nurse in the hospital, or it might be somebody that you make referrals to in the community. Have a chat, especially if you've got a bit of a hairy case. Everyone will be happy to talk because they've all been in the same situation. And they're always willing to talk through something. So definitely just reach out.
Yeah, and I think that's so spot on, isn't it? That if you've thought something, someone else will be thinking it too, right? And you don't have to hold it on your own. Actually, that it's kind of related. And I had a question. Maybe Jess can answer, and maybe Lisa, depending on. So, I think probably one of the biggest things that's important for a longer career in palliative care is to be able to look after yourself, and not in a cliched way, because we're exposed to so much suffering and sadness. And, I think we could probably all think of the ones where you just think there is no logic behind this. Like, this is unfair in every way. And I guess my question to you is, what are your, because I reckon this is the most important thing to get set up in your career in palliative care. What are your strategies to deal with that aspect of the job? And it's probably something I wish I'd got on to earlier. Do you want to answer first, Jess? Yes?
Yeah. Yep. So I think for me, what I learned over a bit of time, because you know, it's all a bit wishy-washy. We talk about self-care, and you know, doing some mindfulness, and all of that is really, really important. But I think for me, recognizing when it's affecting me, like the home Jessica, because you know, we carry our work through our work day, and most of the time we can then switch over into home person, and then carry on our work and our life at home and be that separate person. When you're finding that you're driving home and your usual things, your music, your ABC radio, maybe your audiobook, whatever it is, and you're finding your mind go back to your patient, because no doubt it will be one patient who's sitting with you, and we never quite know why. And this is for palliative care professionals, as well as people who are working in aged care or on the wards or in community, anybody, because everybody, palliative care is everybody's business. Everybody's working with people who are going through awful things and are suffering. When that patient is still sitting with you, that's when it's time to take action. And I know for myself, when I have a day off and I can feel my energy levels are low, I can feel my mood is low, and I'm not necessarily even thinking about a specific patient necessarily, but it just feels like I'm on the go slow. And you've been going, you know, 1,000 miles an hour at work to get the work done, but then you find yourself just, you know, you're getting through stuff, but your brain's just feeling a bit foggy. That's the time to take action. And for me, and that's about finding what it is for you. For me, it's doing something where my brain has to be engaged completely fully. It might be going for a hike and exhausting myself so that it is just the next step in front of each other, going to the gym and lifting something really heavy so that I have to really focus on what I'm doing. And talking and finding that person to talk to. And it might be supervision at work. It might be a friend or a colleague, like I've got with Sarah. It might be your manager, just saying, look, and there is nothing wrong with, if you're finding that it's taking you, you know, if you've got one day off and you just can't quite get out of that funky mood, consider having a mental health day. Like you have to accept when you need a little extra time, because sometimes we've got this stuff going on at work. Sometimes we've also got stuff going on at home. At the moment, I'm supporting friends of mine who have got a dad who's in the terminal phase. And that's, you know, I've gone from work to another hospital to sit with them. So that impacts. And when you're dealing with suffering at work, if you're also dealing with suffering at home, it's a lot. So you have to, it's not, you have to be able to take that time that you need. And sometimes you'll need it.
Yeah, and I think my kind of thoughts around that are very similar, Jess. It's a kind of the answer to this question for me is about it's like a process of self-reflection, getting to know yourself. And for me, a helpful thing has been to be able to kind of figure out what's the pattern? What's the pattern? What's the pattern to me feeling really shit and kind of awful after work? And for me, it's patients that are similar age to me, similar life circumstance. And I have, because I know that pattern about myself, I actually do something, and I wonder whether you guys do this too, if anyone else who's listening who does something similar. But if I know, say, for example, if I'm going to see a baby who's dying, and I know that's kind of in the realms of what's going to be sad, very, very sad for me, I sit in the car and I draw like an invisible line around myself. It's very weird, right? But it really works for me. It's like this protective layer of professionalism. Like, and I go into the home with that invisible line just around me, and I don't know if but for some reason that really helps me. And the other thing I think, and this is what you were saying, Jess, is that it's so important, I reckon, to know what your thing to separate work and life is when you get home. Have a routine. For me, it's a shower and a cup of tea. And I'm going to put something out there that's slightly controversial, and I hope it's not too controversial, but my 2 cents is that we all love a glass of wine, right? But if your circuit breaker after a terrible shift is a glass of wine, I'm challenging you tonight to find something different. We love a glass of wine, but to me, we want to get it away from a glass of wine. Anyway, what about you, Lisa? What do you think?
I agree with that. I think I'm still learning about how to manage my way through this, because while this is probably the most rewarding job I've had, it's definitely the hardest and the
Yeah.
most challenging. I think my husband sees the change in me before I realize it.
That's
And I
interesting.
know by how he says to me, "How are you?" that I'm like, oh, okay. So, you know, I know going to bed some nights, there are clients who are in my head. And so I put on put on the raindrops that plays for 12 hours or whatever, and I have to turn it up quite loud, and that drowns out the work thoughts, and it actually helps me go to sleep.
So interesting. And this is it.
Yeah.
Everyone will have something different, right?
And then I think I do come away from some clients and you feel more affected than others. And I actually ask myself the question, what is it about that one?
Right.
What is it about that one that's made you feel the way you do? And try and figure out, because I think if I understand what the triggers are,
Yeah.
then I'm more prepared for them when
Yeah.
they come.
Absolutely.
So,
And you kind of can do then your mental, whatever it is, protection before you
yeah,
go in.
and then because you can preempt then if you know what you're going into and you know that that's something that's going to get you.
And in
then
fact,
prepare.
actually, someone, when I was talking about this webinar at work today, I was picking my colleagues' brains about her thoughts. And she was saying, along the lines of this question, she was saying, knowing what are the patients, reflecting on what are the patients that really get to you, and giving yourself permission to say, no, to your boss, I really need space from this patient today. Or I really, if I can you allocate me a different lot? That's not always possible, but it's okay, right? And speak up for yourself. That's what she said. Don't feel okay to speak up for yourself.
It's interesting you say that, because I know initially people would say to me, oh, are you all right to go back there? You've been there a few times. And I kept saying yes, because I thought that was the right answer. And now I've learnt to say, actually, you know what? I'd probably rather not today.
Yeah.
Yeah.
Yeah, exactly. And actually people respect that.
Yeah.
Yeah. And it's okay.
And I realised I was being asked for a reason. So
Yeah. Okay. And
Yeah.
and I just having looked at the chat here, Shani says meditation or playing with the kids is great. Amy says debrief is another great way to mentally relief. And yeah, absolutely. It's just everyone will have their own. Does anyone else who's sitting there have anything they want to share about how they disconnect at the end of a shift?
While we're waiting for that, I think another thing to talk about, and it's something that I think as palliative care nurses we joke about a lot, is that when young people become incredibly sick and die, you get a little paranoid about your own health and the health of your family. And we always laugh, oh, I've got a headache, it's just the GBM or whatever it is. But it does, let's be real, it does sit with you. And I think a strategy that I've worked out for that is to, drive home, sit in my driveway for a minute, take a deep breath and say, I'm safe, my family's safe. No one knows what tomorrow will bring, but today I'm safe and my family is safe. Because otherwise it can just, for me, it can ruminate around my head that you don't know what that little thing is. And you see these awful things of people being diagnosed really late, quite young. And it's very difficult not to remember that that's such a small proportion of what's actually happening, because it's what you see day in, day out. So I think that's an important thing to remember as well.
Yeah, absolutely. I remember I've heard bereaved clients say that their carers say that their loved one will die and they'll go back to life and they just can't believe that no one else was even aware that it was going on. Like, it's such a bubble that we're in. And it's hard to not hear someone's sick and then think that that person's going to die, but actually it's such a small percentage of the population. Yeah. So I guess then I've got another question, which I don't like. Probably won't surprise anyone who's listening that I'm very enthusiastic, but I have found, and this is just between us as however many people are here, I have found it's taken a very long time in my career to be taken as a new person, to be taken, it's not seriously, but to not be taken as just like, I don't know how to describe it. It's like you arrive in a new workplace and you have seasoned nurses approach you almost with a little bit of cynicism. Like you have to prove yourself before you get to, and I guess that's something I've come across a lot. Is it something that you've experienced, Jess?
Yes, and that's probably why we're friends. Because we can be excitable. And I think it's a hierarchy thing. Yes, absolutely, I agree. And it can be difficult, and it can also be some people are burnt out. And having people come in who have fresh energy can be a little bit uncomfortable when you're burnt out. Because you don't have that energy anymore. And it's a nursing thing. That's right. Because I think there are a lot of nurses out there who are just perpetually burnt out.
But then the question is, what do you do? Because I had a new nurse who'd done the course recently at the course that we run at work. And I was chatting to her and she's like, she was so enthusiastic and she's got it's just so great. But she's like, what do I do? Like, and so my advice to her, my first thing was, when you arrive somewhere new, keep a little notebook of all the things that you think that they can, that all the things you're noticing that you want to tell them need to be different, right? But actually, in the first instance, just keep the notebook, and in a year's time, 6 months maybe, depending on how you're going, then start to feed it back. But when you first start, I think actually going in with too many, hey, we did this, or that doesn't make friends. What do you reckon?
Yeah, completely agree. I think taking a moment to do that situational observation, and that's quietly just watching and accepting a little bit how things are right now, because it's that way for a reason. It's come to be that way for a reason, and understanding how it got to be that way will give you the power later on to look at your list and work out what are the easy wins and what are the things that are going to take you a bit longer to change within that you've come to. So just understanding the situation, but don't let go of your enthusiasm. Don't let them beat it out of you, and you're here. So we're preaching to the converted, because these are all people that are still maintaining their interest, who are doing their own things in their own time mostly. So maintain that, and just keep finding people who are the same as you and who are interested and who are excited, because you will find people within your workplace who are like, that is a great idea. And you don't have to push it forward right now, but that is a great idea.
Yeah.
So just keep your passion.
Yeah, and you got to find your people, right? Because actually who you want to find are people who go, yes, totally, that's a cool idea. And there are those people around. And actually, in my experience, PCNA, and this is not an intentional plug, but PCNA is definitely one of those organisations. Like so, if you're struggling to find your people in your workplace, PCNA, like this organisation, is worth being part of, kind of getting more involved, being part of our webinars and
Crew.
the connect and shares and crew, because they're so supportive. If you're someone new and you want to start being a nurse practitioner and doing that, this PCNA group will be like, yeah, totally. Rather than...
We went to the webinar, and it was the first webinar I've been to, and not webinar, sorry, the conference. And I walked away with like 4 different ideas for PhDs, connecting with this person and that person about projects that we're going to do. So, palliative care, again, is a niche area, and you're going to have to network across Australia and even internationally, because there's people out there doing amazing things, and we all have to link with each other, because we don't have the numbers in our individual organizations to make really good change. So we have to link with each other. So however you do that, whether it's PCNA, whether it's reaching out to people, but that's what's going to help us with our excitement and maintaining our passion and improving things.
Yeah. So now I wonder, now Jess, Lisa and I have done a lot of talking. I just wonder if there's anyone in the group who has a question, and we will go back to that other question, but we might go just on this topic on starting your career or challenges in a workplace. Does anyone have anything that on their mind that they'd like to ask? So, Anna, while you're thinking, I'll give you a minute to think. While you're thinking, I'm going to ask Lisa, what do you love most about your job?
I know it sounds really trite, but I love that I actually make a difference.
Oh, yeah,
You can
no,
actually
totally.
see it. You walk out of the house and they tell you, and you get feedback later, and when you've gone a couple of times, and you can see that you actually really can make a significant difference.
Yeah, that's the same with
It's the
me.
impact you can have.
Yeah.
It's still sort of is a bit mind blowing to me that we as a group can have such a big impact on somebody's life and on the future of the people who are left behind.
Yeah,
It's
very profound in
Yeah.
some ways, isn't it?
yeah.
You perfectly articulated what is my favourite too, part of it.
Yeah.
So that's. And what about you, Jess? What's your favourite part of the job? And then we've got some questions.
So I think the privilege of being allowed during a time when everyone else is, often closed out, and the palliative care clinics are invited into that space with the family. It's an honor. It is. It's an honor and a privilege to be there with the family in that time when even extended family are not in that room. So, and I love the communication actually, and I just didn't feel like I got that in other places that I've worked. Just being able to communicate and help people understand what it is that they want. Whereas previously, you don't get a lot of that. It's things that are done to people and for people. Whereas here, you're helping them work out what it is they want, where they want to be, how we're going to make that work, and that's really nice.
Okay, so thanks, Jess. So I'm just reading some of the questions. So I'm just going to go through the chat just a little bit. Rebecca Shepherd, thank you for that. She said it's such an honour, and it is just so. Where are you, Beck? There you are. Yeah, it's such an honour. Like it's yeah, and I'm going to look. There's a question here. From Beck, how do I actually get the foot in the door? That's a great question. Currently doing agency work for aged care on weekends. So can I ask, just pop in the chat, Beck, what state are you in, just for context? Or you could probably unmute yourself. That might be easier, actually. Oh, what did you say? Ooh, Queensland. All right. So Bundaberg. Okay. Does Bundaberg have a community palliative care service or a palliative care unit at all? There's nodding heads. Lisa says, Jenna's nodding. If there is, so this, look, it'd be interesting to see what Jess thinks about this because Jess has been a manager. But I think if there are community palliative care services in your area, my 2 cents would be to pick up the phone and call the managers of those services, or maybe start with an email and say, "Hi, I'm Rebecca with this experience, and I'm really passionate about palliative care." You apply for casual pool. I really want to get into community palliative care or palliative care. Could we speak on the phone, and then seeing what they say. What do you think, Jess?
Yeah, and I think I took this away from the conference. I can't remember who I was talking to at the conference, but just, and this sounds awful, but be annoying. Be annoying. It feels annoying. You're not being annoying, but it feels annoying and it feels uncomfortable to feel like you're harassing people and saying, "This is something I'd really like to do. This is something I really want to do. How do I do it? What do I need to do?"
Yeah, what do you want from me to get it? Yeah.
Yeah. And people, when you employ people, that you don't have to tick off. Lisa said it before, she didn't come with any healthcare experience. I came from research before coming into palliative care. So it's not about palliative care. Is not about having the right skill set. It's about being the right person. And the fact that you're passionate about it is showing that you are the right person to be. Yeah, show your passion. Exactly. Yeah, exactly. So, and be annoying. Show your passion, be annoying at the same time. And find the right person. And if you're not getting any joy with that person, find another person.
And I can put a little bit of a plug for, so if the person you call and you're being annoying to says, "Oh, you need experience or something," there are ways of kind of getting in there. Lots of different kind of online, there's a huge amount of online resources that you could do and then say you've done to show that you've done, like there's, as I can see Kylie there, there's an awesome website called PCC4U. That's got an amazing set of resources for new palliative care workers. PACE, there we go. So you can like that, and that PACE is a website that gives all the resources, doesn't it, Kylie? Yeah, that's right. So I guess if that's what they're saying you need, that's a way of showing it. But I think that what Jess is saying is right, is just to get in their face and say, this is what I really want to do. How can I make it happen?
Even if you've got limitations on when or how you can work, because, you know, a lot of people have families and it's difficult. Tell them what you can do, tell them what you're offering, and tell them how passionate you are. I think we're not very good. I don't know that we've got any men. I can't see any men on the screen. Historically, as women, have been very good at being annoying, but advocate for yourself and talk about how passionate you are. Not great at blowing my own horn. Exactly. That's exactly right. We've got to get a little bit better at it, because that's the way we get what we want. I'm not great at it either.
Yeah,
it's okay, but it is also okay to be annoying. It's important, because somebody like you who's really passionate about it is doing this work. So think about the patients. You've got to get yourself in there for the patients.
Yeah, and actually what Kylie's just said is right too, right? It's that, so if you're in an aged care context, put your hand up for the palliative care patients, because then when someone asks, do you have palliative care experience, you absolutely do. You know, and you just have to not even spin it, but you just have to sell it in a way that actually that is, and it is solid experience.
It is, and not even caring for people in the terminal phase, you know, looking after people who have metastatic terminal cancer, who are going home to die. That is palliative care. Looking after the symptoms, doing pain assessments on people that's palliative care. And making sure that you talk about your experiences, not just people at the end of life, but people in their palliative journey, which goes right from diagnosis. And that will do you a good stead when you're talking to people, being able to recognise that as well.
Yep, and to reach into PCNA, you know, like this is an organisation that really wants people that want to be that are generalist nurses doing palliative care and palliative care specialist nurses. So, you know, PCNA can definitely be helpful. Does anyone else have any? Thank you, Kylie. This is good to have these resources.
Pepper's great, and Pepper's a really good program as well.
Is there any other questions? Is there anyone else who
Yes, there was.
Oh, good.
So sorry, I'm just going to go back up on the chat. So Shani says, Shani, whereabouts are you located? Remind me. It sounds like you're looking at setting up some palliative care services where you are.
Oh, India.
Yeah.
What time? Just for curiosity's sake, what time is it in India right now?
In a rural community.
Oh, wow. 11:20. That's okay. You didn't get up at like 4 a.m. for our wedding. That's good.
I'm not entirely sure. It's a huge endeavour to get a service set up and running. But maybe we're not the right people. We think big. I've got plans for a hospice with a poppy field out the back, so we never run out of Ordine again. But maybe we need to think about who we can connect you with.
Yeah,
Shani, that might be able to talk through it a little bit better.
And maybe what we do, that's a great idea. And Shani, if you pop your, no, I might.
I'm thinking Jenica.
Yes, exactly. We have, Jess and I both have some connections who have been very, very much part of service development in India and Nepal as well. So maybe Shani, we get you to I might put my email in the chat and you email me after, so then we can connect you with someone who can answer that question better.
Kylie, you are so helpful.
Anyway, what did Kylie say? Oh, yeah, go on. Exactly. Yeah, exactly. I should have done that, Kylie. I'm part of that organisation.
And this is and this is the benefit of these kind of interactions where we can all just get together and talk and connect, because like I said, we have to connect with each other across Australia and internationally because we're too small on our own. So that's really great.
Is anyone else got any other questions? Have a look. Days of, oh yes.
Oh, of
It's
course,
Diwali,
it's the
isn't it?
Festival of Lights. Happy Diwali.
Happy Diwali. Yeah, so I guess if there's no other questions, that's really the end of the formal part of our webinar. If everyone is open to it, if you pop in the chat maybe one thing that you've gained from the webinar, or you've learnt, or you're going to take into your practice, and then I think we'll finish up. Is everyone feeling game enough to have a go at that? Thank you for participating. And
Be annoying, yes.
yeah, I love that. Be annoying. It's a great takeaway. Sharing about resilience building. Yeah, right. And it's just about being part of things like this to be like, oh, this is a shared experience that we're all going through.
So that be annoying is funny because I seem to apologize for that a lot. Like, I'm sorry, I know I'm annoying, but I'm just going to ask again because I just want to clarify.
Sharing and and so Gail says, okay to give to me too. Right, absolutely. And look, honestly, I think if that's I wish, it's probably the most important thing, right? That you're it. You got to feed you got to feed your soul before you can do your work. Kylie said, being somewhat disconnected, enjoying connecting and being with enthusiastic clinicians. Well, we're excited to have you here too, Kylie. Thank you for and Karen, great to see some support for nurses. Thank you very much. And then it's okay to not know everything. That was a great takeaway, wasn't it? Yeah, absolutely. Being kind to myself. There's support out there. Yeah, that's right. Being vulnerable is okay. Right, absolutely. So look,
and I think that's what Sarah and I, one last thing, I always have to have one last thing, but I think that was something that Sarah and I really wanted to come across in this webinar. Is that it's okay to talk about it warts and all, and that's something that Sarah and I are really passionate about. We don't have to keep that to ourselves, and that, you know, reach out to somebody and have a kind of discussion, because it's important. It's hard. It's really hard what we do. And that's across the board.
And I think too, kind of associated with that is be your authentic self, right? If you're at work and you're feeling like I need to be a person or like away in a home, then that's, you know, probably not that's never going to serve you, right? Being your authentic self is always is kind of a good approach, I think.
Yeah.
Yeah. So look, thank you for, I guess, and James will kill me if I don't put a plug for PCNA. So I probably have a bit anyway, but if you are interested in stuff like this, please join PCNA as an organisation, because this is the type of stuff we do, and we really want to be there to be your people, right? Like to get you started and feeling good about palliative care. Thank you, and fill out the survey when it gets sent, please. And Shani said, what about nursing diagnosis? What we might do, Shani, is take that offline, but I'll give you, just type in my email. Hold on, everyone can have my email. That's okay, I don't mind. Begley at EUC.au. And just email me, Shani, those questions, and I can point you in the right direction. Is that okay? Yeah, cool. Please do keep in mind PCN is new to know. Absolutely. It's huge.
Yeah. Yeah, got a big responsibility there to develop it, Shani. Yeah.
All right. Well, thank you, everyone. Have a lovely afternoon. Thank you for joining.
Happy Halloween, happy Diwali. Bye.
Happy Diwali. Bye-bye.